Hi, my name is Stephen Marsh and I want to welcome you to the RRS podcast and also Pavlina Todorova, who is my guest today, to talk about her research.
Sure. I am currently a graduate student at UT Southwestern Medical Center in Dallas, Texas, and I'm a part of Dr. Sandeep Verma's group. We are working on a NASA project assessing brain cancer risks from exposure to heavy particle radiation. And I have two models that I'm working on assessing brain cancer risks.
Okay, great. When you are working on these models, can you tell me about the mouse model that you're working with?
Sure, yeah. We are focusing on glioma. So we are exclusively irradiating mice with particle radiation in the head, so they are only exposed in the brain. And we have tumor suppressor deletions in these models that are also targeted to the brain. So we have this very specified system with the radiation and the deletions only in the brain. And the choice of tumor suppressors is informed by what is commonly seen in human patients. So the one model is losses of INC4A, INC4B, and ARF, while the other model is deficient in P53 and P10, which are two big groups of tumor suppressors lost in human patients.
Excellent. Can you tell me about the applicability of this to space research?
Sure, yeah. As I mentioned, it is a NASA project, so what they're interested in finding out is whether there will be a risk for the astronauts when they go in space and they're exposed to particles, whether there's any chance that there will be an increase in their risk to develop brain cancer. And we are particularly interested in brain cancer, which is because it's a very serious disease that currently is resistant to most types of therapy. The average survival after diagnosis is only about a year, and it's only about 5% survival overall. So really prevention is the way to go at this point. So if we can discover some risk, it is important that we come up with strategies to avoid, just to ensure the safety of the astronauts.
In the brain cancer, glioma specifically, can you tell me about the posters that you have involved here at RRS? You have two posters, one of them about risk, and then the other one about DNA repair mechanisms and how those can transition into a possible attack strategy.
Sure, yeah. The lab overall is interested in glioma. As you pointed out, we have multiple projects that are focusing on disease. My work focuses more on development and risk factors, while there are other projects in the lab that focus at therapy strategies or resistance or why some patients respond better than other patients. So we really are trying to attack the disease from all sorts of angles. So I am mostly involved with heavy particle work, so I'm better versed on that project, but the other work is also very interesting, really looking at the radiosensitization.
Sure. Where do you irradiate? How do you get your heavy particles?
We go to Brookhaven National Lab at the NSRL laboratory, and we use carbon beam, hydrogen beam, silicon, iron, and then compare tumor frequencies based on the different particles and the different LATs. We go there 3 times a year, and it's really a fun and exciting endeavor.
Excellent. Pavlina, you're a scholar in training, and I was wondering about your experience as a student and a little bit about your interest in the radiation community.
Sure, yeah. I think I became a member in 2012, and my first conference was in New Orleans. I think that was 2013. And this is actually my second time coming here. So I've really enjoyed my experience with RRS. I found a lot of mentors, a lot of friends, and coming continuously allows me to develop close relationships, to see how people's work is evolving. So it's just really interesting and gives me an opportunity to be more involved, to look for collaborations, to meet new students like you. So it's been really fun, and I'm really happy to be a SID scholar.
Excellent. Yeah, I think that RRS has shown me a lot of great familiarity and generosity in terms of the ideas that are shared. that people are here to get a gauge on what's going on throughout the community, but also to share and to meet and to have some fun together.
Yeah, exactly. It's in a way it's small enough that you get to know people, but then in a way it's big enough that you're exposed to all sorts of really interesting projects and people from different fields that are all working on radiation, but nevertheless are studying very different things.
Definitely.
You know, there's the workshops on grant writing, the workshops on careers have been really informative.
Can you tell me a little bit more about your experience at Brookhaven National Lab? I understand that you are using several different ions for your tumor risk study.
Sure, yeah. The early studies that we did there were exclusively with iron particles because first we wanted to make sure that HZ particles are indeed carcinogenic. So the first few years of me working on the project were mostly focused on iron, but there are different particles, so we're trying to recreate what is in space. So in space it's not just iron, there's mostly proton, there's carbon, heavier particles like silicon. So what we wanted to do was to expose the mice to different particles and see whether we're going to get different tumor frequencies, whether heavier particles are more tumorigenic versus lighter particles, whether there's AT effects or any dose effects that we can pick up.
Excellent. Well, I'm really glad that you were able to make this interview. I'm very happy to have Pavlina here to speak with me today about her research and her activities as a scholar in training.
Sure, thank you for this opportunity.